and chewing is not an adequate answer. I'll be a little more specific than that. I want you to know the components of the teeth. I want you to know the dental formula, how many and what kind of teeth we have in our mouth. Both the deciduous, or what we call baby teeth, the primary teeth, and the secondary or adult dentition. You need to know that. What you don't need to worry about is when they erupt, because that's quite variable. But for the types of teeth, the specific function, structure, and the dental formula, how many and what kind of teeth you have. Fortunately, it's the same on the upper and lower jaw, assuming you have all the teeth. Okay? We'll start with the incisors. The incisors are kind of chicken shaped. These basically are used for cutting, okay, or biting off pieces of food. It's usually what you bite with your incisors, unless you're eating ice cream, unless we don't bite down ice cream. People are usually pretty sensitive. These are incisors, okay? The canines are these. Okay? By the way, I have a pair of central incisors and lateral incisors, both upper and lower jaw. Those are your front teeth. Unless you're a hockey player and get smacked with a stick or puck, you probably still have your front teeth. Okay, this is the cuspid, also called canines, or dog teeth. They're very prominent in major carnivores, not in humans, unless maybe vampires. Okay, those are the fangs. I'm not very impressed in humans. They look sort of like a giant incisor. These are used for shredding and tearing. Cuspid because they have one basically projection on the occlusal surface. So it's a cuspid. Okay? Canine, and then implant. And then we usually have a pair of those upper and lower. Then we have what are called the bicuspids. This has two projections on the occlusal surface, so it's called a bicuspid. This is a cuspid, and it's one projection. These are also known as premolars. These are used for grinding the food, breaking it down into tinier pieces. Bicuspids or premolars. And then of course the molars, which are the largest teeth. They have multiple projections here, okay? And again, they're used for grinding as well. They're very well developed, particularly in plant-eating animals. This one has a couple of areas. By the way, when you see these things, you're only going to see one. I'm not going to put them all out here here. And you're not going to have them on stand because stand is later. You don't expect to see that. You see this. Go back to that. Okay, so those are four of the types of teeth and their function. Now let's go through the structure. Now, the part of the tooth visible above the gum is called a crown. Show here in white. This part here is the crown. The part of the tooth in the socket is called a root. Each tooth should have a crown and one or more roots. Because the human teeth and the molars usually have multiple roots, 2 or 4. So crown, the part of the tooth above the gum, and the part below the socket is called the root. At the gum line is a constricted area, that's called the neck. Crown, neck, and root of the tooth. The gums themselves, like fancy, are called gingiva.
What is the neck?
The neck is this constricted region between the crown and the root, usually right about at the gum. Again, the gums are called the gingiva. You get inflammation called gingivitis. Okay. Lapse in the periodontal disease, we see more serious as a result of tooth loss. Okay, the crown is covered by the hardest substance in the human body. That's called enamel. It's a hard, calcified substance. It's not bone. It's called enamel. Enamel covers the crown, and that's the hardest substance in the body. It's bone-like and it's full of calcium salts. That's actually harder than bone. But the unfortunate part is we can't regenerate it. So once it disappears, it's gone. That's why if you have a cavity and it erodes the enamel, then it has to be replaced by some substance to put in the tooth, a filling. dentin actually makes up most of the mass of the tooth. It's deep to the enamel. It's shown here in kind of a off-white or ivory color, and little striations in it. That is basically the interior of most of the tooth. It's called the dentin. So it's deep to the crown, or deep to the enamel, I should say. It's also deep to the part of the root, which makes up the exterior. The exterior root is part of what's called cementum. So the crown has enamel, the root has cementum, and then deep to that, this mass here, the striations in it, that is called the dentin. And that can be regenerated. We have cells that regenerate it called odontoblasts. They line this cavity. You see here in pink. This is called, in the crown, that's called the pulp cavity. This continues the cavity that runs into the root, which is called the root canal, which is also named a dental procedure. How do you remember it? Okay. We've had a very pleasant experience. When they drill, basically they drill out the nerve, basically, and fill it with some inert substance. So again, material covering the crown is enamel, material covering the root, cementum. Deep to both and making up most of the mass in the interior of the tooth is the dentin, lining the pulp cavity and root canal, odontoblast, which can regenerate the dentin. So you can regenerate the dentin, you can't regenerate the enamel. What holds the tooth in place is a ligament called the periodontal ligament. That holds the tooth in the socket. Remember, the tooth and socket is a type of joint. Okay? It's actually a fibrous joint. Called what? Anybody remember? What's it called? Gomphosis. Very good. A type of fibrous joint called a gomphosis. That will not be on the test. It's also a stereoarthrotic joint, which means it's immovable. So your tooth is moving around, that's not a good sign. It's usually solid. It's usually something pathological. Okay. Okay. There's also a little opening, and let me show here to you, like the apical foramen at the base of the root, and it's through that blood vessels and nerve fibers enter the tooth. That's why your teeth are very sensitive once you've got a root canal. Okay. You can sense touch, obviously. You can sense changes in temperature and pain. You know. Again, the apical foramen is an opening here at the base of the root where blood vessels come and go, and also nerve fibers. Any questions on the teeth? So know the different types of teeth, know their specific function, know the structure of the tooth, know the dental formula, which is pictured in your book. You look under teeth there, 860 and 862. Okay, it shows the teeth and it shows the dental pattern. And again, for both the deciduous or primary teeth, deciduous because they fall out, deciduous tree is one that drops its leaves, okay, at the growing season. And then the primary, or it should be the secondary adult dentition, you should know too. Okay? What I won't ask is when they erupt, and that varies. A lot of parents get very concerned because the baby hasn't cut any teeth, except maybe the mother, she's breastfeeding. She's glad the kid doesn't have any teeth. Okay? When he or she has teeth and they start to bite and chew,